Tell us a little bit about the connection that you see between the health system and education. That's interesting.
Well, I think it's one of the big findings from the pandemic that suddenly the whole world was aware that children have a mental health crisis, because we don't think of children as having vulnerability with mental health, just physical health. And I think it was a marriage of classroom teachers appreciating a new need in children, and the children are our most resilient and I think best resource for the future. And suddenly that discussion is there. It's not just about making sure that children have their polio shots in school. It's about making sure that their mental health issues are being addressed in school, because children who are feeling sad, sick, or lonely, and that's the whole medical trio, are, like I was saying earlier, they're not receptive to learning. So I think schools could very easily become where public health services are delivered.
I asked you all yesterday to come up with one word that you think we need to keep in mind and embrace, in a sense, as a concept for when it comes to the future of education. Mary, let's start with you. What's your word?
Empathy.
Empathy. And why?
I think it's the ultimate human trait, and we now understand from all sorts of business studies and education studies that if you don't have the capacity to connect with yourself and the other, you are going to be a withering soul. And it's also about your morality.
Right.
And we know the climate, if you don't have empathy, you don't care about the people on the other. So it relates to everything. But in education, the ability to have empathy allows you to really understand the other and take advantage of what's being taught.